So this is a cat that's come across to us for a second opinion. So you can see that both eyes are quite different. So the left eye there is the normal eye. The right eye, you can see, is quite abnormal. So we've got an increased sort of vascularity there. But if you look carefully, you can just see a mass actually within the eye itself. So this cat's actually got a tumour growing within the eye. So we've done an ultrasound, and I'll show you the images of that shortly, which shows the mass within the eye. So our plan for today is we're going to do what we call staging. So we're going to check to see if this tumour spread anywhere else in the body. And if it hasn't spread, then we're going to look at removing the eye, send the eye off to the lab to find out what sort of tumour it is, and we'll work out if we've got a cure or whether we need to look at some other treatments to go with it. So this is the ultrasound image of the eye with the tumour. So what we can see here, this around here is the edge of the eye. This black area is all fluid, so that's really what we should be seeing most of the way through the eye. And all this white tissue here is all abnormal. So that's the tumour that we're having to remove the eye for. So it's a pretty big tumour within the eye, but they're quite hard to spot without sort of advanced imaging, because this is in behind the pupil. So yeah, we'll remove that eye and we'll see what things look like. So this is the eye we've just taken out. It's a little bit discoloured because we've had it in formalin. Now we've got the whole globe out intact, which is really important when you've got a cancer in the eye, because if you accidentally open the eye up or the tumour up, you've probably caused a lot of spread. Now the really good news is this here is the optic nerve, and that's a normal looking optic nerve, so very much we're hoping that the tumour hasn't spread out along the optic nerve at this point. We'll send that for histopathology at the lab, and we'll have an answer in a few days, both as to what the tumour is within the eye, but also we'll get confirmation as to whether it's spread outside the globe down the optic nerve or caused any problems. But looking at this, I'd be very hopeful we've had a curative surgery. And this is what the eye area looks like after the surgery. So when we take a globe out from tumour, we unfortunately have to take out the eyelid and all the surrounding tissues. So rather than ending up with an empty socket or anything like that, we basically close everything over. So once the hair regrows, we actually get a really good cosmetic result from this. So although the cat's lost one eye because of the very frontal positioning of their eyes, they actually don't lose a lot of scope of vision. They do lose that 3D vision, of course, but really we expect most cats to function almost completely normally with just one eye. So yeah, we'll keep you up to date with what the pathology results tells us, and we'll let you know when we get those.